Uceris Aerosol, foam with applicator, is used for treating symptoms of a certain bowel disease called ulcerative colitis. It helps reduce inflammation and belongs to a class of drugs known as corticosteroids. While it doesn't cure ulcerative colitis, it may help relieve symptoms like abdominal pain, diarrhea, and bloody stools. Using this medication as a foam allows it to work directly on the bowel and rectum. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before using Uceris Aerosol foam with applicator, make sure to read the patient information leaflet from your pharmacist. Follow the illustrated directions for the proper use of this medication. Use this medication as a foam in the rectum as directed by your doctor. Usually, you will use it in the morning and evening for the first 2 weeks, and then once a day in the evening for the next 4 weeks. It is best to use this medication just before bedtime in the evening. This medication is flammable, so avoid smoking when applying it and immediately afterward. Do not use or store it near heat or open flame. It is best to use this medication after a bowel movement. You may apply it while standing, lying down, or sitting. Do not insert any part of the canister into the anus. Use the enclosed applicator to apply this drug. Warm the canister in your hands and shake it well for 10 to 15 seconds before use. Hold the canister upside down and gently insert the applicator tip into the anus. Push down on the pump and hold it in that position for 2 seconds to apply the foam. Afterward, release your finger from the pump and continue to hold the applicator in place for 10 to 15 seconds. Then, remove the applicator and throw it away. Wash your hands after use. Keep the medication in your rectum for as long as possible, for example overnight. If you are regularly taking a different corticosteroid by mouth, do not stop taking it unless directed by your doctor. Tell your doctor or pharmacist right away if you have withdrawal symptoms. Use this medication regularly to get the most benefit from it. Use it at the same times each day. Do not increase your dose or use this drug more often or for longer than prescribed. Do not stop using this medication without consulting your doctor. Tell your doctor if your condition lasts or gets worse. If you experience nausea that lasts or gets worse, make sure to inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. In rare cases, this medication can be absorbed into the bloodstream, leading to potential side effects of too much corticosteroid. These side effects are more likely in children and people who use this medication for a long period of time. You should contact your doctor immediately if you experience any of the following side effects: extreme tiredness, weight loss, headache, swollen ankles or feet, increased thirst or urination, vision problems, bone pain, changes in mental health, or symptoms of stomach or intestinal bleeding. It's also important to be aware that this medication may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infection. Contact your doctor immediately if you experience signs of infection, such as a persistent sore throat, fever, chills, or cough. While it is rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Uceris Aerosol, foam with applicator, it's important to tell your doctor or pharmacist if you have any allergies or if you have a medical history of certain conditions. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. It's important to inform your doctor or pharmacist about your medical history, especially if you have liver disease, high blood pressure, diabetes, bone loss, stomach or intestinal ulcers, certain bowel diseases, mental or mood disorders, high pressure in the eye, cataracts, infections, thyroid problems, or if you are pregnant or breastfeeding. Using budesonide for a long time can make it more difficult for your body to respond to physical stress, so it's important to inform your doctor or dentist before having surgery or emergency treatment. Additionally, it's important to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Budesonide may mask signs of infection and make you more likely to get infections, so it's important to stay away from anyone with an infection that may easily spread. It's also important to inform your healthcare professional before having any immunizations or vaccinations and to avoid contact with people who have recently received live vaccines. Older adults may be more sensitive to the side effects of this drug, especially bone loss, stomach or intestinal bleeding, and mental or mood changes. It's important to see the doctor regularly if using this medication for a long time, especially for children, as it may temporarily slow down a child's growth. During pregnancy, it should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Uceris Aerosol, foam with applicator. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication without consulting your doctor. Some products that may interact with Uceris Aerosol, foam with applicator include aldesleukin, mifepristone, and drugs that can cause bleeding or bruising. If your doctor has recommended low-dose aspirin for heart attack or stroke prevention, continue taking it unless instructed otherwise. Be sure to ask your doctor or pharmacist for more details. If Uceris Aerosol, foam with applicator is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important to be cautious with this medication to ensure safety. When taking Uceris Aerosol, foam with applicator, it's important to follow the recommended dosage and schedule for optimal effectiveness. Always consult with a healthcare professional for personalized guidance. It's important not to share Uceris Aerosol, foam with applicator with others. If you are on long-term corticosteroid treatment, it's important to make lifestyle changes that may help reduce the risk of bone loss, osteoporosis. These changes include engaging in weight-bearing exercise, ensuring you get enough calcium and vitamin D, quitting smoking, and limiting alcohol. Be sure to ask your doctor about any lifestyle changes that may benefit you. If you happen to forget a dose, simply use it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed one. Just continue with your regular dosing schedule and avoid taking 2 doses at once. This medication should be stored at room temperature and kept away from heat and open flame. It is important to keep all medications out of reach of children and pets. When it is expired or no longer needed, be sure to discard the product properly. It is recommended to consult with a pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.